agency, the National Public Health Agency, it is responsible to comprehensively strengthen the public health systems so as to predict, prevent.
Brigadier Professor Foday Sahr has his first major test at hand as head of Sierra Leone's recently established National Public Health Agency, or NPHA. It follows the detection of 2 polio viruses in the country in separate events, as revealed by the agency last week. On March 8, a 1-year-old child in the northern district of Cambia was diagnosed with the type 3 poliovirus. A day later, tests from sewage sample from this location in Mabela, one of Freetown's most densely populated slum communities, came back positive for the type 2 poliovirus.
When we identified this variant of poliovirus, what did we do as a response or as an agency? We elevated the Emergency Operations Center to level 2 to effectively coordinate the response. And we are working very closely with our partners, especially the Ministry of Health, which is our supervising ministry, the World Health Organization, the US CDC, UNICEF, and all our technical partners to implement a very comprehensive response plan.
The National Public Health Agency was born out of this increased wish to have that capacity, which has been realized. And so I think this is one of our first test cases in terms of this outbreak. And since the start of the outbreak, as the technical people will delve into, we have been really alongside the ministry with the National Public Health Agency. From the last week, up to the Saturday morning, the minister himself and myself were here to provide that leadership in terms of being considered the best for this country.
Polio is a highly infectious disease that largely affects children under 5. It causes paralysis and, in extreme cases, death. The virus is transmitted through contaminated water or food, or contact with an infected person. But the disease is preventable through vaccination. There are 2 main types of polioviruses: the wild poliovirus, which is circulating naturally in the environment, and the circulating vaccine-derived poliovirus, which is a mutated form of the virus used to manufacture the oral polio vaccine. Each of these is further categorized into types 1, 2, and 3. The good news, according to officials, is that both viruses currently being investigated as circulating vaccine-derived. Thanks to vaccination and sensitization, the World Health Organization, or WHO, in 2020 declared wild poliovirus eliminated globally, except for 2 countries, Afghanistan and Pakistan, where the type 1 wild poliovirus remains in circulation. But the vaccine-derived poliovirus also remains in circulation. In the last several months, cases have been reported across several West African countries, including Sierra Leone's closest neighbors, Guinea and Liberia. Sierra Leone reported its last case of wild poliovirus in 2010, and in 2020, it reported its last cases of the vaccine-derived poliovirus. Officials are warning that while these latest cases are also vaccine-related, they pose no lesser threat to the public, hence renewed appeal for parents to ensure that children under 5 are fully vaccinated.
Within 14 days, we are actually supposed to do the round 0 of our vaccination. And like I said, we have done that quantification and we have submitted the request for that. And within 56 days, we are supposed to conduct 2 rounds of immunization and possible mop-up.
According to WHO, as long as a single child remains infected, children in all countries are at risk of contracting polio.
We cannot do anything and say you don't have any challenge. You must have challenge. That's what makes it an issue for you to overcome. Okay? One of the very clear obstacles to polio eradication, is the fact that one is an expensive venture. It's expensive, it takes time, you need a lot of people to come together to be committed, government to come together to be committed, organizations to come together to be committed to pull forth. Okay, and you know there are so many developmental challenges globally for different countries, different parts of the world. So polio is just one of them.
The NPHA was inaugurated in December 2023, tasked with managing public health emergencies in the country. Professor Sahr, a medical microbiologist, has experience dealing with some of the most challenging public health emergencies in Sierra Leone's recent history, from the 2014-2016 West African Ebola epidemic to the COVID-19 pandemic. He is confident that the task at hand can be surmounted with support his agency is already receiving from traditional partners, WHO, US CDC, UNICEF, and the Global Vaccine Alliance, Gavi, as well as the Sierra Leonean public itself.
For us, this is a priority, and so we're very glad to see that this rapid response to this event has been stood up in such an impressive manner. You know, as partners, our job here is to work closely with the NPHA and with the ministry and really provide, as people wish, technical support and financial support to the extent that we're capable. But as you can hear from today's presentation, you know, Sierra Leone is taking the lead in this response, and really we are just sort of here as part of the team to implement. So I have every faith that this response is going to be a successful one.
I want to allay your fears. Similar cases have been reported in other West African countries, which highlights the regional dimension of this public health threat. Young children under 5 are most vulnerable to this debilitating disease. We therefore urge all parents and guardians to be vigilant and ensure their children's vaccination status is up to date.